Measles is on the rise in some parts of the world. According to the World Health Organization, there were more than 42,000 measles cases in Europe last year. Now that's a 40-fold increase from 2022 when fewer than 1,000 cases were reported. So why is this rise happening now? Well, part of the reason is because some children missed routine vaccinations during the pandemic. Measles hasn't been a concern for decades, but in places where vaccination rates have dropped, there is a growing risk of outbreaks. So how concerned should we be about this? Joining me now is the province's Chief Medical Officer of Health, Dr. Janice Fitzgerald. So let's start with our vaccination rates here. The ideal vaccination rate is around 95%. How are we doing in this province?
Yeah, so when we look at vaccination rates for MMRV vaccine, which is the vaccine that gives the measles vaccination, we look at that at 2 years of age because we normally give the vaccine at 12 and 18 months. And we certainly are at that 95, 97 range for vaccination rates in that age group. So we're quite happy with that and very confident in that result.
Yeah, the WHO talks about how some children around the world missed their measles vaccination during the pandemic. Just those routine vaccinations weren't happening. How did we do with that during the pandemic?
Certainly, like everywhere, there was some, there was some gaps there for a while. However, public health has been working quite diligently to ensure that that catch-up has happened. And so, we did see a little dip during the pandemic, but we're pretty confident that that has come back up now and that we're, that age group has been adequately vaccinated.
So what is the vaccination rate for school-aged children?
For school-age children, it does drop a little tiny bit, of course, because we have kids who come in and join that cohort. But we're still certainly approaching that 95% mark. Little less some years, right on at other years. But yeah, we're pretty close.
Can you remind us what measles is? This is a disease that we have not seen in this province for a long time.
Yeah, so it's a disease caused by a virus, and that virus is quite contagious, more contagious, say, than flu or COVID or any of those types of viruses.
And highly contagious in the sense that you don't even need to be standing next to a person to catch it, right?
That's right, yeah. With airborne spread, that's the concern, is that it can linger in the air. So even after you come into a room, when the person who has measles may have vacated, you can be exposed and become infected. However, the vaccination, if you have 2 doses of a measles-containing vaccine, that is nearly 100% effective, really approaching 100% effectiveness at preventing measles infection. So that's why it's so important for people to be vaccinated against measles.
When you see what's going on in Europe, 42,000 cases last year, jumping up from just 1,000 cases the year before, it's an alarming increase in the number of cases. How concerned are you as someone who works in public health when you see that kind of increase happening elsewhere in the world?
Our biggest concern when we see things like that is ensuring that we do have good vaccination rates, because that is the key. That's the key in protecting the individual, but it's also the key in protecting the population as a whole. And so making sure that we have vaccination rates that are at that 95% rate is certainly, that's where our focus is when we see stuff like this.
Yeah, there is vaccination hesitancy among some people now. If people are hesitant to get this vaccination, is there a worry that we could see a resurgence?
Yeah, so anytime you see a reduction in vaccination rates, as this has proven, there is always that risk of introduction of measles into a susceptible population. And, we have seen that in the past there were a few years ago in the US, there were a couple of small outbreaks. And so we do see that from time to time. Measles is not gone, so, there's always that risk of introducing it into the population. So yeah, it's really important to try to focus on increasing those vaccination rates and for people to understand that measles vaccine has been around for quite some time. It is a safe, effective vaccine at preventing what is and can be a pretty significant disease with long-term complications.
When was the last time we saw a case of measles in this province?
So the last cases that we had were I think around 2017, and they were travel related. So not something we see very often, and thankfully here with our immunization rates, generally speaking, they are travel related. So yeah, that was the last cases we saw, but did not result in onward spread anywhere.
All right, well, Dr. Janice Fitzgerald, thank you so much for this. Really appreciate your expertise.
Thank you.